What's up everybody, I'm Brooklyn with JJ Safety, and today we're going to be discussing what Naloxone is. Naloxone, or more commonly known as Narcan, is a medication that is designed to rapidly reverse opioid overdoses. This is an opioid antagonist, which means Narcan binds to the opioid receptors and can reverse and block the effects of other opioids. In order to understand the use and importance of Narcan, we must understand what opiates are. Opioids are a class of drug that relieve pain and can produce a pleasurable effect on the brain and the body. Opioids can be prescribed by doctors for pain relief, can be synthetic, and can be illegal. The most common opioids include prescription opioids, methadone, oxycodone, and hydrocodone, synthetic opioids, fentanyl, and illegal opioids like heroin. To begin with, it's important to know that Narcan can only be used to reverse the effects of opioids. This means that Narcan will not work on someone who is overdosing on a non-opioid drug such as cocaine or methamphetamines. How do opioid overdoses occur? Opioid overdoses do not always occur due to an illicit drug use. They can happen due to a misuse of prescription opioids. Let's look at some ways an opioid overdose can happen. A patient misunderstands the directions for use, takes an extra dose, or deliberately misuses their prescription. Illicit drug use, taking someone else's prescribed opioid medication, and mixing other opioids with medications, alcohol, or other over-the-counter drugs. Ways to recognize an opioid overdose may include abnormal breathing, very slow or the breathing has completely stopped, pinpoint-sized pupils, bluish lips and nose, or the person is unresponsive to touch and voices. It's important to understand that anyone can administer any form of Narcan. In some states, people can receive training on how to administer it, but it's not required that people have training in order to administer it. Once you have identified that the person is suffering from an opioid overdose, you can then administer Narcan. There are 4 forms of Narcan. The most common form, which is the nasal spray Narcan. Then you have the auto-injector, nasal spray yellow cap, and an intramuscular needle syringe. To administer the nasal spray Narcan, peel back the package and remove the device. Hold the device with your thumb on the bottom of the plunger and your 2 fingers on the nozzle. Place the tip of the nozzle in either nostril until your fingers touch the bottom of the victim's nose. Then you'll press the plunger firmly to release the dose into the victim's nose. To administer the auto-injector, you'll pull the auto-injector from the outer case. Firmly pull off the red safety guard and do not touch the black base, as this is where the needle is going to come out. Place the black end of the auto-injector against the outer thigh through clothing if needed. Press firmly and hold in place for 5 seconds. There will be a distinctive sound such as a click or a hiss when administered correctly, and the needle will not be visible after use. To administer the yellow cap nasal spray, pry off the syringe's yellow cap from the top and the bottom. Pry off the purple cap of the Naloxone capsule. Grip the clear plastic wings on the spray nozzle. Thread the spray nozzle on the syringe, and gently screw the Naloxone capsule into the barrel of the syringe. You'll then insert the white spray nozzle into the nostril. You're going to give short, firm push on the end of the Naloxone capsule to spray the Naloxone into the nose. You'll then administer 1/2 of the Naloxone capsule into each nostril. To administer the intramuscular needle syringe, you're going to inject 1 cc of Naloxone straight into the muscle, which could be the thigh, outer quadrant glute, or the shoulder. After administering Naloxone, immediately call 911 and follow instructions given by the dispatcher. If there is no response from the victim within 2 to 3 minutes of administering the first dose of Naloxone, you can then administer a second dose. Everyone has access to Narcan. Narcan has recently been approved as an over-the-counter opioid overdose treatment, meaning there is no prescription needed to purchase Narcan in stores. You can also access Narcan through local community-based organizations, law enforcement offices, training courses, local pharmacies or health clinics, public libraries, and substance abuse centers. Note that access to Narcan may vary in each state. Check with your state on where you can access Narcan.
For more information, visit us online at jjsafetyllc.com or call us at 866-627-3850.